So, all right. Hello everyone. Okay, we're back. So our next presenter is Raluca Rusu. Is a researcher and a PhD candidate at the Theoretical Philosophy Department of the Doctoral School of Philosophy at the University of Bucharest. She is also the main organizer of this conference, and today she will present on metaphysical beliefs and psychedelic experiences, which is also part of her doctoral research. Yeah.
Thank you, Ciro. Hello, everybody. One moment to see. Okay. No, it's 5 FM. It's not working. Yes, that's
Yes.
okay, great. So, in recent years, there has been, yes, of course. Please tell me if you can hear me from the mic. It's okay? Okay, I will try to remember to keep my voice up. Thank you. In recent years, there has been a resurgence of interest in psychedelics, both in scientific research and popular culture. What was once dismissed as countercultural curiosity has now become a subject of rigorous scientific investigation. Clinical studies have demonstrated the therapeutic potential of substances like psilocybin, LSD, DMT in treating conditions such as depression, anxiety, PTSD, and addiction. Beyond their medical applications, psychedelics offer unique insights into the human mind. They provide a window into altered states of consciousness, allowing us to explore questions about the nature of reality, the self, and the boundaries of human experience. These questions are not only philosophical, but deeply practical as they relate to how we live our lives and make sense of the world around us. Today, we stand at the crossroads where ancient wisdom and modern science converge. Indigenous cultures have long recognized the transformative power of plant medicines, using them in sacred rituals to foster healing and spiritual growth. Modern research is now validating these traditions, uncovering the neurobiological and psychological mechanisms behind their effects. As someone deeply engaged in the study of consciousness, I find this convergence both exciting and necessary. Psychedelics are not merely tools for exploration, they are mirrors reflecting the depths of our inner world and the possibilities for human transformation. As a PhD candidate in metaphysics and philosophy of mind, my research focuses on the nature of reality and consciousness, but also on what psychedelic experiences could teach us about these subjects. As Stanislav Grof stated, psychedelics will be to the study of the mind what the microscope is to biology and the telescope is to astronomy. Today, I will resume at exploring how do psychedelic experiences alter our metaphysical beliefs and how does this contribute to psychological transformation. This presentation will examine how individuals who engage in these experiences often report significant shifts in their fundamental understanding of reality, migrating from strong materialism to perspectives such as panpsychism, idealism, or dualism. Today's presentation is based on the analysis of the research conducted by some of the leading scientists in the field, like Christopher Timmerman from the Department of Psychiatry and Brain Science, Center for Psychedelic Research from Imperial College London, Chris Letheby from Department of Philosophy of Psychedelics from the University of Western Australia, Robin Carhart-Harris from Psychedelic Division, Department of Neurology from University of California, and UC Ilko, PhD in Senior Research at the Psychology Department at Abo Academy University from Finland. And that's why I guess my emotions are very high because UC is online with us today now. And I'm very emotional about it. Their findings are supported by my own research, grounded in empirical data from the Core Metaphysical Beliefs Questionnaire, applied to a total of 26 participants to ayahuasca ceremonies conducted in Peru which tracks changes in individuals' worldviews before and after psychedelic experiences. The importance of this topic is that it bridges the gap between empirical psychology and philosophical inquiry, offering data-driven insights into how altered states of consciousness can reshape our understanding of the mind, self, and reality, also contributing to well-being. I will give a little background and context. Metaphysics is a branch of philosophy that studies themes such as the fundamental nature of reality, consciousness, and free will. Research has shown that most people hold distinct metaphysical positions. Metaphysical beliefs are the foundational assumptions that we hold about the world and about the nature of reality. And these beliefs can be only broadly categorized as materialism, which is the view that reality is fundamental, physical. Dualism, the belief that mind and matter are distinct, but they interact somehow. Idealism, the belief that consciousness is the primary substance of reality. And panpsychism, which gained some terrain lately, some field, that is the view that consciousness is a fundamental aspect of all matter. Psychedelic experiences characterized by altered perception, ego dissolution, and mystical insights frequently challenge these foundational beliefs. And we'll see how significant are these changes and what patterns we can observe. Previous research has shown that psychedelics can lead to lasting psychological transformations, but recent studies have begun to document their impact on philosophical worldviews. Some evidence has demonstrated that psychedelics can reliably and robustly induce intense, profound, and personally meaningful experiences that have been referred to as mystical type, spiritual, religious, existential, transformative, pivotal, or peak. Griffiths and all demonstrated that psilocybin experiences, psilocybin is the compound found in magic mushrooms, often have lasting spiritual significance, while Latabai argued that psychedelics can induce a metaphysical breakthrough, a shift from materialist to non-materialist views. However, a systematic investigation of this shift, specifically using the metaphysical beliefs questionnaire, has been limited until recently. In 2021, Christopher Timmerman, in collaboration with Robin Carhart-Harris and Hannes Kettner and Chris Latabai, published a study in which they exploited a large sample derived from online surveying to determine whether and how beliefs concerning the nature of reality, consciousness, and free will change after metaphysical use. The results were substantial, revealing significant shifts away from physicalist or materialist towards panpsychism and idealism post-use. They developed a survey requiring respondents to answer questions pertaining to a range of metaphysical beliefs before and after attending a ceremony in which a psychedelic compound was taken. 866 respondents completed the survey at different time points at baseline, which was 1 week prior to the experience, 4 weeks and 6 months after attending the ceremony. The researchers applied the self-constructed metaphysical beliefs questionnaire and items extracted from the free will and fatalistic determinism subscale of the FAD plus questionnaire. I won't go any deeper into the methodology. I will only share the results of their study and their conclusion. Converging cross-sectional perspective, observational and controlled research, data suggests a relationship between psychedelic experiences and shifts away from positions of hard physicalism and towards panpsychism, dualistic and fatalistic beliefs. The observed changes were enduring, persisting up to 6 months in most domains. Furthermore, the belief shifts were correlated with positive mental health changes, namely improvements in well-being in the observational data and depression scores in the controlled research data. Regarding the last statement, we continue with another study conducted by UCLCO, Andreas Trabe and Patrick Jern in 2024. Their study explores the relationship between metaphysical beliefs and psychological well-being, specifically focusing on idealism. Therefore, the main objective was to determine if idealistic beliefs mediate the positive psychological effects of psychedelic experiences. Conducted via an online survey with 701 participants, from which 629 remained as final sample, who had previously used classical psychedelics like psilocybin, LSD, DMT, mescaline. The researchers used a novel questionnaire entitled Core Metaphysical Beliefs, but also other questionnaires. The goal was to assess the structure of metaphysical beliefs in a sample of participants with experience of psychedelics. Moreover, they aimed to examine whether metaphysical beliefs are associated with past psychedelic use, as well to examine the correlation between endorsement of metaphysical beliefs and mental well-being. I will skip the methodology and present the results they had. Two primary belief factors.
Sorry to interrupt you. It's just that the slides, they are not moving online, so they are stuck. Over there is fine, but they are stuck on the first slide. So maybe if you can just exit the full screen and switch back to right.
So they
we can now see previous research. So that's the right slide, right? Yeah.
Yes.
Good.
So
sorry.
from online, everybody says it's all good.
Yeah.
Okay.
Sorry.
Great. So the results were two primary belief factors were identified: idealism, the belief that consciousness is fundamental to reality, and this factor consisted mainly of idealism and panpsychism related items, as well as a notion about the positive nature to the ultimate nature of reality. For example, love is the ultimate nature of reality. This factor was positively associated with psychological insights from psychedelic experiences and overall, I just realized now that it didn't move. Okay, and overall well-being. And the second belief factor was materialism, the factor that reality is entirely physical, and the materialism factor included ontological theses such as there is nothing but the physical, but also scientific items like science is the only way to know reality. So good. Okay. This factor was not significantly associated with well-being. The results suggest that psychedelic experiences may enhance well-being by fostering idealistic beliefs. It is not simply a rejection of materialism, but an active shift toward idealism that is linked to better mental health. Now, my own research. My own research is only at the beginning. It's part of my doctoral thesis entitled Philosophical Aspects of Mental States Induced by Psychedelic Substances. My research was conducted in Peru, a region with a rich tradition of plant medicine. Until now, I've had two groups of 14 Romanian individuals each, with an age range between 20 and 70 years. The first group was in October 2024, and the second group was just now, April, May. We just came back from Peru. And the setting was intentionally chosen because of its cultural significance, providing participants with an authentic experience. During the ceremonies, participants consumed ayahuasca, a psychoactive brew, which contains DMT used traditionally for spiritual and therapeutic purposes. Shamans guided the ceremonies using Icaros, sacred chants believed to facilitate healing and deepen the ayahuasca experience. I'm mentioning this because some of the people testified at the interview after the ceremony, testified that these kind of chants were very important for them, guiding them through the experience and also guiding their own vision, the visions they had. The procedure was that they took part in 3 ayahuasca ceremonies, spaced across several days to allow for recovery and integration. Each ceremony followed the structure format, was preparation, the intention setting, and some of them even did meditation. We've discussed before about their if they have a certain intention or not, or what are their expectations. They had this discussion with me, but also with the shaman who was going to have this ritual with them, so that all the questions they had, or everything they wanted to figure out before the session in order to have their set good in a good place was arranged. Because in this kind of rituals or ceremonies, as you already mentioned, the speaker before, it's important the set and setting. So we assured that these were compliant. And after the ceremony, they had the integration the next morning with the shaman. Some of them wanted to discuss individual with me, and we talked about the visuals or the realizations they had. So this was part of the integration phase. I administered 2 questionnaires, the methodology. Core metaphysical beliefs questionnaire and mystical experience questionnaire. I will only share the results from the first one today, because it's about this thesis about the metaphysical beliefs change. The participants completed the core metaphysical beliefs, the one that Giusilco used in his research at different timelines. First time before the psychedelic experience, second time immediately after, and I will be asking the participants to fill out the questionnaire again in 6 months, because I'm still, as I was saying at the beginning of the research. The questionnaires included 42 statements that were rated on a scale from 1 to 7, from strongly disagree to strongly agree. The items represented 14 metaphysical ideas, like ultimate nature, positive ultimate nature, materialism, dualism, scientism, moral realism, monism, lots of isms, idealism, panpsychism, process relational ontology, simulationism, free will versus determinism, teleology, multi and single perspectivism. Up until this phase, my research is consistent with the findings of the studies mentioned above. The evidence demonstrates a shift in metaphysical beliefs towards an idealist or panpsychist view. What you can see is the sketches are only from pre and post filling out the form. First, you will see that materialism drops a little. Most of the participants, especially those who were strongly convinced about physicalist, which were physicalist, it decreases after the ceremony. The dualism was diverse. There were persons, usually both, for example, materialists, realized that there is not only about materialism, and in some other case decreased because if they were thinking about dualism, they started believing or shifting towards idealism or even panpsychism. Scientism is the same as it's decreasing also, and for monism, idealism, and panpsychism, we can see a rising perspective in worldview. There was a person who didn't drink ayahuasca, She only, so what we saw is that she didn't change the position. So this was very interesting. From the other questionnaire, I said I wouldn't share the results, but it's important to share some of the results because of the statement that I said it influences positive mood and everything. So from the other questionnaire that I administered, mystical experience questionnaire, and also from the interviews I conducted with the participants after the ceremonies, I can also say that there was an improvement of their psychological state, which might link the metaphysical beliefs shift towards idealism and panpsychism to well-being. The highest average score was in the positive mood dimension, indicating that participants frequently experienced profound emotions of joy and happiness or simply peace. Participant 7 achieved the highest total MEQ score of 95%, reporting a deeply transformative experience. And participant with number 4 had the lowest score, with reduced ratings especially in transcendence of time and space. Participants described their experience as profoundly and ineffable, using phrases like an overwhelming connection to the universe and a sense of infinite love and understanding. Several noted that the Icarus played a central role, with one participant stating, "The chants seemed to guide my journey and unlock hidden emotions." And we are talking here about the participant who said that he wasn't able to feel emotions before. This study provides valuable insights into the phenomenology of mystical experiences induced by ayahuasca. The findings highlight the potential of psychedelics for advancing our understanding of consciousness and its therapeutic applications. Data suggests that altered states of consciousness might hold not only transformative potential, but also epistemic value. The integration of philosophy, psychology, and neuroscience highlights the importance of interdisciplinary approaches in understanding the mind. Psychedelic experiences, when approached with intention, respect, and proper integration, and that's why I insisted on the integration at the question you were asked before, hold the potential to catalyze profound and lasting transformations in individuals. These experiences transcend the ordinary boundaries of consciousness, offering access to new perspectives, emotional healing, and the re-evaluation of core values. As our understanding of the neurobiological, psychological, and metaphysical dimensions of psychedelics deepens, we recognize their unique capacity to challenge and expand our understanding of self, reality, and the existence. The transformative potential of psychedelic is not merely theoretical, but is supported by growing evidence from both clinical research and personal accounts, from aiding in the treatment of mental health disorders to facilitating personal growth and spiritual awakening. Psychedelics have the capacity to bring about significant positive changes. However, the ethical, cultural, and philosophical implications of these substances must be navigated with care, ensuring that their benefits are accessible, safe, and responsibly integrated into both therapeutic setting and personal development practices. Looking ahead, continued research is essential to further uncover the mechanisms underlying psychedelic-induced transformation and to develop best practices for safe and effective use. As we stand at the crossroad between ancient wisdom and modern science, psychedelics offer a profound invitation to explore the depths of consciousness and embrace change, not as a fleeting moment, but as a continuous journey of becoming. Thank you. So,
Any questions?
how can I unshare? Let's stop share from here. Okay.
The red one.
Yeah.
Good. So we have.
Let's start with the ones in the room and then we move to online. Right?
Okay.
Yeah, thank you for the presentation. I was wondering why did you choose ayahuasca instead of other psychedelic drugs like such as psilocybin, for example. It was something cultural, if I'm not wrong, and correct me if I am. I know that ayahuasca is used most of the time in indigenous cultures. Is that so? So it
Yes.
was something culturally, or that was part of the experiment?
This was part of accessibility, let's say so. My doctoral paper, it's not only about ayahuasca, it's also about psilocybin, LSD, and mescaline. So we had I was able to be there and conduct the research physically because I had this retreat with the groups in Peru. So I was able to be there. Because of our illegal matters in this country, I cannot have the research here. So what the rest of the research I intend to conduct, for example, in Holland with psilocybin. I also had the chance in Peru to, but I didn't include it in this study. There were participants that took San Pedro. San Pedro is another plant medicine from Peru. San Pedro contains mescaline, and San Pedro is even more prominent. I don't know how to say. It's even more felt on the positive aspects, on the positive aspects of well-being, because ayahuasca, it's like guiding you through a process, a healing process, and maybe a process of realizing things, while San Pedro is guiding through an emotional process in which you open up your heart. That's what they declare about San Pedro, that it's like an opening to the nature, and even the setting is different. For example, in ayahuasca, we have the setting in Maloca. Maloca is a traditional place in which, around traditional building, in which the ayahuasca is taken, the brew is taken during the night, so that you have no stimuli, no visual stimuli, no nothing else except the Icarus, the sound of the chants of the shamans, while San Pedro was taking in the morning, during the day, going on the mountain and connecting with nature. And the experiences were different. Thank you. I hope I
Yeah, that's great.
Thank you.
That's great.
Yes.
So, as per my understanding, you applied the actual study, the questionnaire while being there with the group, right?
Yes.
So the results were immediately after the consumption, after living the experience, correct?
Yes. Yes, and I'm still waiting to bring the follow-up, so to see what happened after 6 months, but I just didn't. Yes, yes, yes. Yes. Yes, 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 and I can wait for it. Okay, yes.
Hi, can you tell us more about integration sessions? As you said, they're super essential for positive transformation, and I've seen people come back from ayahuasca retreats who are unable to reintegrate in the day-to-day. So you can tell us more about
They weren't able to integrate.
Yeah.
I see. So here the integration was, for example, in the first group, the one from October, the integration was done the next day with the shaman and myself, having a group session in which each of them verbalized and talked about their own experience. This created also the connection between the group, and because some of them had similar visions, but each was there for its own situation or aspect they wanted to discuss. The shaman was there, and the shaman told them about the symbols in the culture, in the Peruvian culture, of the things that they saw or that they visioned. Also, there were persons who wanted to discuss about this individually, so they didn't share in the group, but discussed one-to-one with me or with the shaman. I was on the psychological part and about the integration of the what it meant for them. So beyond the Peruvian symbol that shaman gave them, what do they think that it meant for them? What message had the plan for them? And the second group was only one-to-one. So in the next morning, each of participants went to one-to-one with the shaman. We also had the translator. So there was the shaman and the person who conducted ceremonies before, which was also a Peruvian. And she was there translating what the people were saying. And so this was a different integration type, one-to-one with the shaman. We also had discussions during the retreats because we stayed for 2 weeks there. So the retreats were only 3 sessions of ayahuasca. So we were a long time together. And well, this was it. What I can tell you is that none of them, maybe I'm lucky, but none of them, not from the first group, not from this one, had a bad trip or let's say a difficult situation by integrating or bringing this to. Yes. Okay, there was somebody in the back there. Yes.
How did you measure eyesight improvement and when?
Oh, so the example is here in the room with us. Did I put it on the slide? Okay. One person was dyschromat, so he wasn't able to see red on green. For example, he never saw red flowers. He was only seeing, so he was seeing red as brown. And a few years back, he took those glasses and chroma glasses who help you see the colors. So maybe the neuronal part created something in his mind so that he was able to identify red or green or purple or pink or orange, because by not being able to see red, he wasn't able to see pink and orange and everything that contained red. So, but he wouldn't see the colors without the glasses. So he took part in these 3 ceremonies. After the first one, he had different how do you say? Insights. Thank you. I keep thinking about this word from the beginning of presentation. So he had different insights and everything after the second ceremony, other insights. And after the third ceremony in the morning, when we were all in the garden and we were in the magical garden with lots of flowers and little birds and everything. And suddenly he said he started crying. And I was, okay, what's happening? And he said, I'm seeing red. I'm seeing the flowers. And we were all around him, and we were asking him, and he was asking, is that red? Is that purple? Is that pink? Is that orange? And it was, in that minute, I started searching about studies, and there are some studies, but on psilocybin that showed that persons gain temporarily the ability to see colors. Well, we just got back from Peru, so it's 2 weeks since we got back, not even 2 weeks, 1 week and a half, and he's still seeing red. And we just said that we should talk, or we should find somebody at biology or medicine or ophthalmology or neurology who would be interested in having this research. because it's very, very interesting. Yes. Sorry, we still have some questions from the room, and we will
We'll switch to
switch. Yes.
It's very interesting what you said. It made me think that with psychedelics, some studies show that people with aphantasia, the inability to visualize mentally, they still have closed-eye visuals. So it might be something you need with the part of the brain related to,
Yes.
I
guess so.
deep or processing.
That's right. So just to brief follow up, to my knowledge, Eric Schwitzgebel actually talked about it, that they actually kind of tend to do this. So it's an ongoing research. If you guys have
Great.
any insights.
What is the name?
Can-
I'll tell you, I'll write it on the
Yeah.
board.
Please write it on the so we have it on the messenger.
And I had two questions too.
Yes.
Was it the first experience with psychedelics or in a mystical way for the participant? Or-
Two of them had experiences with ayahuasca before, and 4 or 5, I'm not sure about it, had also experiences with psilocybin before. And you know, it's very interesting because those who had experiences before with another compound, a psychedelic compound, from the beginning they had high scores on idealism, panpsychism, or dualistic aspects than those who haven't experienced before. And maybe it's a link in exactly what UC Ilko's research is, that the people with psychedelic use have the openness to idealism and
Confirms
yeah.
past experience. And
Yes,
actual
yes.
studies.
Yes.
And the last question. I'm curious if you can tell us if this kind of studies are published, I mean not published, funded in Romania, or is it?
Not as far as I know in Romania, not yet. There is a association, Psychedelic Care from Bruxelles, who are trying to approve the research and psychedelic assisted therapy all over Europe. So they are gathering signatures for this right now, and we hopefully will see in the next years that this kind of therapy and this kind of research will be available in Romania too, hopefully.
Very useful information.
Thank you. Thank you. So I will take some questions from
Right. So first of all, you had one in the chat from Finn. So do you believe the increase in panpsychist idealistic beliefs may actually be a challenge in persuading Western academic philosophy to take psychedelic use seriously? Many in academia are already hard materialists in my experience, and this data might unfortunately be more of a reason to ignore psychedelics. How might we overcome this challenge? Do you think it needs to be overcome?
well, it's you know, you can't argue with someone who has certain beliefs. So it's not if a person has those certain beliefs and are not open to it, you cannot change it. I'm happy to see that in academia, and look at this room. People are starting to open their mind to this kind of studies, and to see what I had this challenge, because I was having this subject and this theme in Romania and nobody heard of it. And my first interactions with academia was, what are you going to do? Are you drug us all? I said no. And after that, I sent some of the research, especially Chris Letterby, Robin Carhart Harris, Yusilko, and after reading the research, they started to be more flexible and to be more curious about what's this all about. And today we are having this conference at the University of Bucharest at the Faculty of Philosophy, and I'm very grateful for that. Thank you, Finn. What's Werner and then Jussi?
Thank you very much. Can you hear me?
Yes.
Okay, excellent. I have two questions. One pertaining to the nature of your study. I would like to know if using a setting that is pre-inclined towards a particular metaphysical conviction does not presuppose your thesis. In other words, using a setting that you did that's within a traditional context that's inclined towards certain metaphysical ideation due to the physical space in which participants are in, does not defeat asking the question whether it allows metaphysical convictions in particular senses if you kind of guide it towards a particular metaphysical conviction because of the setting in which these experiences take place. That is my first question. Then my second question is, how can integration be effective if integration takes place in a environment that is removed from the environment in which organisms actually live? So if you have your particular participant and integration takes part at your retreat, yes, this might be for their metaphysical convictions, but problems of integration normally take place with people going back into their day-to-day life. So should that not be the target of integration? Thank you.
Thank you. So I will answer to your last question. So because it was the last put, and then we come back. So the integration that was held there was with the shaman and everything, but they also have access to myself. I'm also a counselor and therapist, and they have my phone number, and we said that we would talk about these things for integration. I already had a meeting this week with one of the persons who were in the retreat, and we kept talking about it and how that the experience from there apply here. And they also have, for example, their own psychotherapist, and if they need to integrate, they can do this with their own psychotherapist also. And to answer to your first question, I'm not sure about this aspect of setting. I tell you this because I have also some persons who completed the another questionnaire, the metaphysical, the mystic experience questionnaire, and were in from Holland on psilocybin, and they had some similar aspects on some similar visions about it, and some similar shifts of beliefs, and they were in their own setting. So it was not a cultural different setting. It was not a different setting at all. And they had the same. Well, I'm not really, this is what I got till now. But as I was saying, my research is at the beginning, and I still hope to have the possibility to take this research even further and have participants with different experiences so that I can focus on this kind of aspect of the psychedelic experience aspect. Did I answer, Werner?
Yes, thank you. I appreciate it.
Thank you. Thank you. You see?
Yes, hello.
Hello.
Is your name pronounced Raluca?
Yes.
Yes, thank you, Raluca, for the very fine presentation. This is like exhilarating because I have been planning to do a longitudinal study with this questionnaire about metaphysical beliefs, and now you did it already, which is really good. Our study is still in progress. We are following people who go to psychedelic retreats, ayahuasca, many different kinds of psychedelics. So yes, very interesting. What is the sample size again in your study?
It was very small. It was 14 people from in the first one, 14 people in the second, but only 26 completed. In total, 26 a sample of 26 people.
Okay, but that makes statistical tests possible that you could statistically compare. It's on the borderline. If the effect size is something like medium, it should be possible to detect the effect. It would be interesting to statistically analyze the results.
Yes.
Are you planning to do that?
I did it only on this this sample for now, and so I will have another retreat next year, another two retreats next year, and for the moment I will see how many people are willing to complete and come to join this retreat, and after that I'm thinking about an online survey for people who had experience this, just like you did.
Yeah, okay, that's really interesting. So, well, yeah, in any case, you already have for something like t-test or u-test to compare the pre-post, whether it's significantly different. It's interesting that you included the whole scale, all the 42 items, because in our study we reduced it to two factors, idealism and materialism. But the original survey or questionnaire was probing a really wide range of different philosophical ideas. So it's interesting to see that you found these trends in several of the factors.
Yes, we made the media for example, to each material metaphysical conception. There were 2 or 3 questions. The 3 questions we made the media for them in order to calculate this and before and after the session, and we'll see what's coming out later in 6 months, hopefully.
Yeah, looking forward to it. Regarding those previous comments from other listeners, at least in Timmerman's study, the participants were, at least some of them were from clinical trials. I think they were depressed patients. So, and assumedly, the session was not ritual or like this, like spiritual type ceremony. And still, the metaphysical beliefs shifted towards some kind of idealism or panpsychism. And also in our sample, when we gathered on crowdsourcing platform, where usually young people partake in studies to get paid. So they are not psychedelic enthusiasts. Like many of them didn't have many psychedelic experiences. They only have few. And still we discovered this association both between frequency of psychedelics use and also on this psychological insight scale pertaining to one single experience. What was interesting was that we didn't find an association between the mystical experience questionnaire and idealism. Although one would assume that the mystical experience is that special kind of experience that convinces people of idealism, but that wasn't associated with idealism in our sample. It was only the PIQ, the psychological insight scale, which is interesting because it's mainly psychological about one's own behavior and thoughts and emotions. Like, for example, an alcoholic realizes that they drink to escape from difficult emotions and stuff like that. And that was correlated with idealism. And also, we haven't published those analyses, but this idealism was also correlated with psychological flexibility. Like these mindfulness type of skills. So it's some, and also well-being. So it's somehow something happens during the experience where people somehow appear to become more aware of themselves, their own selves, and they somehow learn to like become more conscious of their own, like metacognitively aware of their own internal processes, as in psychological flexibility. And that is also related to idealism. So this is something that I don't fully grasp, like what is happening, what is transforming there. And these kinds of longitudinal studies are really important to discover that. Did you have some well-being measures also in your study?
No, I didn't have, because my study was focused on metaphysics actually. So I wanted to
Yeah.
see the belief in changes, but only after I read your paper about positive what about shift in well-being, I realized, oh my God, I can look at this thing too. And I took my notes and see and searched what were the interviews, what did they fill out in mystical experience questionnaire, and a positive mood, and identified like this. It's still not over. I'm still analyzing the results. I just got back, and I'm still on the work in
Yeah.
work in progress.
Yeah, that's really nice that you are studying this phenomenon. Regarding this Finn Thwaites comment about this increase in idealistic beliefs would somehow scare off people from psychedelics. That's related to the comforting delusion argument by Chris Leatherby, that idealism or panpsychism would somehow be false ideas because they contradict materialism. But that's just sort of chauvinism, because no one has ever proved materialism or physicalism. It's just a philosophical ism among many different kinds of isms, like panpsychism and idealism. They are all compatible with scientific knowledge about the reality, and there are no logical contradictions in those ideas. There are and will always probably be different metaphysical ideas which are all equally plausible, and materialism is just in the vogue now. It's because science has been so successful, so people are endorsing materialism, but materialism doesn't follow from science. One can easily accept all of science and be an idealist. So there is no contradiction there. So I think psychedelics can broaden our perspective to new kinds of metaphysics besides only materialism.
That's true.
But yeah, but
Thank
thank
you
you a
so
lot.
much.
This was really a pleasure to hear that you have been using this scale and your results. Thank you.
Thank you so much. Thank you. So I think we have one more question. One more question. Okay, sorry.
It was connected to something earlier about also the results that people reported from the group. I'm imagining that there was a pre-selection and intake, pre-screening to all of this, so you didn't necessarily have to deal in the group with a, let's say, large spectrum of affections or difficulties that might have showed up difficulty in the experience.
Yes, no, there is an interview before. So before making the contract and take them with me, we screened. So we ask about their health state, about if they have any psychological problems, like if they are under any treatment, or if they had in their family. Because, for example, there are some aspects like schizophrenia, if they suffer from schizophrenia or they had in the family. We have second thoughts about that. So luckily, everybody was okay mentally. saying.
Okay, so that was the question, whether you included people
Yes.
that were questionable and you thought like, all right, we
No.
need to keep them under closer supervision because you
No,
know, okay.
no.
And on the other side, complementing on the end, if part of your protocol, speaking of the question of integration, which is a hot topic really, is it part of your protocol is to also more proactively follow through with them instead of relying on them reaching out to you when and if needed, to do like keeping tabs, checking in with them for the purpose even of the research and like figuring out from month to month kind of thing, like how is it evolving instead of maybe just 6 months out, like dropping in and then is it still holding?
Thank you. It's a good idea for me. Thank you. No, it was only, we have the group, we discuss in the group, and they know, they reach out to me, but it's a very good idea, this, about following up more frequently. We have to stop with it.
Yeah, so I can add on that, from the participant point of view, because I can drop out if I go to a depression or something happens.
So you
So
take the
I
rest.
won't.
You won't reach out.
Yeah.
Okay.
Exactly.
Okay. Thank you. It's helpful. Thank you. Thank you, everybody. Sorry.
We're not taking a break. We'll
So-
move to the next speaker and then we'll have a break.
Yeah, because it was a bit longer than we